Hello, I'm Dr. Mikkel Jarman here with Pediatric Foot and Ankle, and today I'd like to discuss bunions, but specifically bunions seen in children, pediatric bunions. When looking at your child's standing foot, they're visually obvious and usually easy to diagnose when you see it. Bunions are the bony bumps that develop on the inner edge of the foot of the first metatarsal just below the big toe of the hallux. And you often see the big toes start to move and migrate into the smaller toes as the foot kind of splays out. This can often cause pain and discomfort or be completely symptom-free. The question that I'm always asked is, why do I have them? What is causing them? And what can be done to stop them from getting worse? And when should I consider fixing them? When bunions occur so early in life, it is not a matter of having had a past sports injury or standing all day on their feet or having worn the wrong types of shoes. Although wearing a tight pair of shoes will certainly make the problem worse in a hurry, it is not the cause in these children. The underlying reason your child is likely developing this deformity is a factor of hereditary and structural considerations. Now, hereditary considerations are demonstrated through the passing of physical traits, a positive family history from mother to daughter, but also because of foot types. And this brings us to structural considerations. Some of us are just more prone to bunions than others because of our low arches or loose ligaments. Bunions in children frequently coexist with flexible flat feet, metatarsus adductus, and ligamentum laxicity deformities. This is where the workup of a pediatric patient is so important because there is such a high bunion recurrence rate after surgery, meaning the bunion actually comes back. This is because the failure to address these other issues. At times, it may be more important to chase and correct the contributing factors that may be increasing the bunion than it is to fix the bunion. Conservatively, orthotics will not fix your child's bunion, but if used to address the other underlying factors that are influencing, it may aid in slowing down the progression of the bunion. In my clinic, pain drives intervention. My job is to evaluate, to educate, so that your child and the parent understands exactly what is happening in their foot, and to allow them to make the best decisions for their care. When surgical intervention is needed, I utilize x-rays and often a gait analysis to judge how severe a bunion truly is, and take measurements of angles between certain bones and to determine the type of procedure needed to ensure a good outcome. I also want to verify that growth plates have closed, which is typically seen in the ages of 15 to 16 in boys and girls. Today's surgical technique and the way in which we treat bunions has certainly evolved and are more minimally invasive, allowing faster recoveries and better outcomes. If you'd like to have your child evaluated and get answers and a clear understanding to what options are truly best for your child, please call our office today. I'm Dr. Mikkel Jarman. Thanks for watching.